The current status and future trend of chemotherapy. Chemotherapy, since the discovery before 70 years, was started to use as palliative treatment, and nowadays became curative treatment for a number of diseases that we're going to talk about. And we have, thanks Allah, a lot of success in cancer therapy, where chemotherapy is used to cure cancer. An example of that is acute leukemias, chronic leukemias, and Ewing sarcoma, choriocarcinoma, testicular cancer. All these diseases is treated by chemotherapy alone, without surgery, without radiation, and cure is the case in majority of the patient. And chemotherapy is used as an addition to other treatment like surgery or radiation or hormone therapy to extend patient survival and reduce the chance of local recurrence. An example for that, the common example is breast cancer and colon cancer and lung cancers. Chemotherapy usually is a part of multi-modality treatment. In cancer, patients get treated by surgery, by radiation, by chemotherapy, by hormonal, by immunotherapy. So chemotherapy is one part of the multidisciplinary treatment. And the example for that in head and neck cancer, where you need to have lymph node dissection and resection of the tumor, and radiation therapy. In addition to chemotherapy, sometimes you have to try immunotherapy to treat this kind of diseases. And thanks Allah, the toxicity of chemotherapy became more manageable. In the past, cisplatin, when it was discovered in the 60s, was held for more than a decade because there is no effective medicine for nausea and vomiting. And once the effective treatment for nausea and vomiting discovered, they go back and use cisplatin as a very useful and very successful chemotherapeutic agent. So we have nowadays better supportive therapy for nausea and for vomiting, for myelosuppression as G-CSF or interleukin for other inflammatory response. Nowadays also there is a trend to use chemotherapy in non-malignancies like in severe rheumatoid arthritis or severe SLE. Sometimes it's used in multiple sclerosis and Crohn's disease. Also, it is commonly used in organ transplantation like methotrexate and azathioprine. So it is not only for cancer, but can be used in different benign diseases. Also, recently, in the last 15 years, there is new targeted molecules which is working in specific target on the cell membrane, specific target in nuclear membrane. And those medicine usually designed to attack certain area on the cells. And the beauty of this kind of treatment, it is highly specific, and its side effect is far below and far better than the chemotherapeutic agent that we know before it cause severe side effect. The targeted therapy usually cause minor side effects like skin reaction and minor allergy, but it attack a certain part of cells, and patient get huge benefit. And the best example of that is Glyfic, which is used in chronic leukemia, and it's improved survival dramatically with minimum side effect. These monoclonal antibodies usually work in combination with chemotherapy, and some of it can work alone, as we said, in chronic leukemias.